We're going to turn now to a public health emergency, in the words of the WHO. An Ebola outbreak that has killed more than 100 in Central Africa, now a matter of international concern. And an American is among the affected overseas. The CDC is taking new action as well. And CBS News correspondent Skyler Henry is there in Atlanta.
Dr. Peter Stafford was serving in the DRC as a missionary doctor for a religious charity when he tested positive for Ebola. He will now undergo treatment in Germany. His wife, Rebecca, also a doctor at the mission, their colleague, Dr. Patrick Laverchelle, and the Stafford's 4 children will also be examined in Germany, as all 6 were exposed but remain asymptomatic. Healthcare workers in the Democratic Republic of Congo are trying to contain this rare strain of the virus, which has no approved drugs or vaccines for treatment. Ebola is contracted through direct contact with bodily fluids and through broken skin. According to the WHO, the average fatality rate is around 50%. This latest outbreak has already spread from the DRC to neighboring Uganda, and the earliest cases went undetected.
They didn't test for this particular strain of Ebola, so it could have been going on for a few weeks. My concern is just, this thing's big, and I think it's bigger than we realize.
Grace Tran was part of an Ebola response team that partnered with USAID before funding was eliminated by the Trump administration last year.
Response is very complicated, and there's a lot of training that has to go into it to make sure that response is done well. That funding disappeared. Funding for Ebola programs disappeared last year.
The Centers for Disease Control says they have activated their emergency response center and are sending a representative to the DRC.
Also tonight, the CDC has issued an order suspending entry for 30 days for non-citizens that have traveled to the DRC, Uganda, or South Sudan over the course of the last 21 days. However, U.S. citizens are exempt. Tony?
Skyler, thank you very much.